Welcome to Accommodate This. This channel focuses on issues preventing neurodivergent individuals from living their best lives. In previous videos, I've talked about obstacles to employment, obstacles to diagnosis, and the systemic biases that many of us face. Today, I'm going to change gears a bit and talk about some of the mental illnesses plaguing the neurodivergent community. And now that you know why we're here, let's get into the topic for this video: mood disorders. Just because a person is neurodivergent does not mean that they have a mood disorder or any other mental illness for that matter. However, being neurodivergent does make a person more susceptible to developing a mental illness. In fact, neurodivergent individuals are about 4 times more likely to develop a mental illness than the rest of the population. And mood disorders are simply one category of many mental illnesses that may possibly develop. Another common mental illness plaguing the neurodivergent community is anxiety, which is in a category of disorders all on its own. And while anxiety is not the topic for this video, I do want to acknowledge that anxiety often precedes or coincides with other mental illnesses. When it comes to mood disorders specifically, there are two main flavors: depression disorders and bipolar disorders. I will talk about each in this video. Depressive disorders are all about depression. It's a mood disorder that lingers on a mood of depression. Sometimes it's worse and sometimes it's better, but it's pretty much depression all the time, no matter how you slice it. And because of that, it's sometimes called a unipolar disorder, because uni means one. The depressive disorders category includes major depressive disorder, which is characterized by depressive episodes that last at least 2 weeks. There's also seasonal affective disorder, which is a form of major depressive disorder that occurs with a seasonal pattern, usually during winter months, and it's also known as SAD for seasonal affective disorder. There's persistent depressive disorder, which is an extreme form of depression characterized by depressive episodes that last at least 2 years. This was also formerly known as dysthymia. There's disruptive mood dysregulation disorder, which includes severe temper outbursts and chronic irritability. There's also premenstrual dysphoric disorder, or PMDD, which is associated with mood changes before menstruation. There's postpartum depression, which is depression occurring during and after the end of a pregnancy due to hormonal changes. It's also known as peripartum depression. There's depression with psychosis, which is a severe type of depression combined with psychotic episodes such as hallucinations or delusions, and it carries a high risk of suicide. And finally, medically or chemically induced depression, which can result from certain medical conditions or substance use. Bipolar disorder is characterized by intense shifts in mood, energy levels, thinking patterns, and behaviors. But the extreme moods a bipolar individual shifts between are depression and mania. That's why it's called bipolar, because bi means two. But you may be surprised to know that even bipolar disorders don't require the person to have full-blown manic episodes. Some people with bipolar disorder get close to mania, but don't necessarily have a full-blown manic episode. It's not about depression all the time. They can also experience periods outside of depression, even those bordering on or reaching full-blown mania. The bipolar category includes lifelong mood disorders causing intense shifts in mood, energy levels, thinking patterns, and behavior. There's bipolar 1, which includes a manic episode severe enough to warrant hospitalization. This is the most severe of the bipolars. There's bipolar 2, which is less severe, but includes at least a hypomanic episode, which is an episode that's close to being manic, but not quite there, and at least one major depressive episode. So they had to have been depressed for 2 weeks at a time. Cyclothymia, which is even milder than that, includes fluctuating mood disturbances that don't meet the criteria for full-blown manic or depressive episodes. And then there's medically or chemically induced bipolar disorders, which can result from certain medical conditions or substance use. So now that we've made those distinctions, what is it like to have a mood disorder? Most of us are familiar with depression, which is a state of sadness and hopelessness. But for most people, depression occurs after or during an adverse life event, such as job loss, divorce, or death of a loved one. And a depressive episode typically only lasts a few days and is not super disruptive to a person's daily function. However, it can turn into a depressive disorder when it intensifies, lasts longer than a few days, impacts your daily function, or has no apparent cause. Those are all indicators that you may have a mood disorder. As I discussed in my video on categorizing autism, a disorder is a deviation from the norm that can be diagnosed but may not be easy to measure. While depression that is caught and treated early is less likely to disrupt your life, it can lead to disability if left untreated and allowed to worsen. In fact, depression is the leading cause of disability in the United States. According to the World Health Organization, depression affects more than 300 million people worldwide and can lead to significant functional impairment, impacting daily activities, relationships, and overall quality of life. Not only can depression be disabling on its own, but if you have another disability, it can add to your depression, which can further impact your disability. For example, many autistics suffer from alexithymia, which is difficulty understanding and identifying emotions. And many of us also suffer from poor interoception, which is an ability to sense and identify internal sensations within our bodies. These together can make it difficult for us to identify when we are depressed, what caused that depression, and how serious or severe that depression may be. So having both a disability and depression can cause the two conditions to inflame one another. And this makes it particularly a concern for the autistic community who frequently have comorbidities. In the United States, as of February of 2025, the unemployment rate for disabled citizens was 7.5%, while it was only 3.8% for non-disabled. And those of us suffering from depression not only die up to 20 years earlier, we have more than double the risk of developing heart disease, stroke, obesity, asthma, diabetes, and poor oral health. Individuals with a depressive disorder find inaccessible health facilities up to 6 times more hindering than others, and are up to 15 times more limited by inaccessible and unaffordable transportation. In other words, depression can make it more difficult to find, obtain, and retain employment, and it can restrict our mobility and our access to treatment and services. In these ways, depression significantly impacts unemployment rates around the world, which averages around 85% for autistics. Unfortunately, despite these very real statistics based on very real people with serious conditions, mental illnesses are not taken very seriously by a majority of the world. Over half, 54.7%, of adults with a mental illness do not receive treatment. A lot of this has to do with the stigma and misperceptions that exist around mental illness. And a lot of it can be reduced to a lack of empathy for those who suffer from mental illnesses. It may shock you, I know it shocked me, to learn that about 79% of people never experience a depressive event in their lives that can be considered serious enough to be deemed a disorder. Only 21% of people in the United States ever experience depression serious enough to be considered a disorder, and only 2.5% ever experience depression severe enough to be considered persistent depressive disorder, formerly known as dysthymia. And while several treatments are available for these illnesses, many people don't even seek treatment because of stigma, misperceptions, and a lack of access due to affordability. I'll talk about treatments a little bit more in a bit. Now, those of you on the spectrum may be thinking to yourself, this sounds a lot like autism. And you'd be right to make that comparison because autistics are 4 times more likely to experience a depressive disorder than allistics. And that's one of the reasons many autistics are misdiagnosed or are not diagnosed until they are mentally ill. However, only about 40% of autistics experience depression long enough and severe enough to be considered a depressive disorder. So while they share similarities, major depressive disorder and persistent depressive disorder are considered mood disorders, whereas autism is a neurodevelopmental disorder. So the mechanisms behind them and how they develop are very different. Now, I've gone into great detail about depression, but let's talk about mania. Mania is a state of abnormally elevated mood and energy. Some people think of it as a state of euphoria, and it can be. Because of that, mania is often preferred over depression, and sometimes even sought after. Many bipolar individuals resist medication because it prevents them from achieving that manic state. However, mania is no cakewalk either. During these manic episodes, a person can actually be quite irritable or on edge. Just because they're feeling good doesn't mean that they're feeling generous, carefree, or perfectly agreeable. They feel energetic, like they could run for hours on end. They feel like sleep gets in the way of what they want to do, and they may not feel tired at all. Their thoughts race through their minds. They talk rapidly, fixate on specific projects or goals, and they may find it difficult to concentrate. In some cases, manic episodes can include hallucinations and delusions as well. So a person experiencing mania is not necessarily having fun. They can be on edge and feel quite dysregulated, though the majority of them describe this as euphoric. Now you might be saying, wait, that sounds a lot like ADHD. Yes, again, there are similarities, but ADHD is more of a neurological difference, whereas mania is a type of emotional episode experienced by individuals with the mental illness of bipolar disorder. So ADHD and bipolar may express themselves very similarly because there's an overlap, but they are completely different in how they develop. Unfortunately, bipolar disorder, like ADHD, is lifelong. But unlike ADHD, you aren't necessarily born bipolar. You can develop it later, such as after experiencing a traumatic event, or through substance abuse, or hormonal changes such as puberty, pregnancy, or menopause. But once you develop bipolar disorder, you're stuck with it. While it's best if you can prevent the development of a mood disorder, your genetics, brain chemistry, and environment may contribute to you developing one anyways. And there are a variety of treatments for mood disorders. If the mood disorder is chemically induced or a result of a chemical imbalance in the brain, it's likely that it will be responsive to chemical treatments, such as medications. However, there's no guarantee. Balancing neurotransmitters in your brain is complicated, and brains can be fickle. Other treatments include a whole lot of talk therapy with a psychiatrist or group therapy sessions. And in severe cases, a person may respond well to electroconvulsive therapy, ECT. It's also known as shock therapy, which is usually administered in doses a couple weeks apart for about 6 months or so. If more consistent and frequent treatments are needed, there's the option for transcranial magnetic stimulation, or TMS, which is basically a brain implant similar to a pacemaker, but for your brain. It's implanted under the skull to deliver shocks directly to the brain on a more regular basis. And for conditions such as seasonal affective disorder, or SAD, a doctor may recommend light therapy, which is essentially prescribing sunlight, real or artificial, during fall or winter months when sunlight is more scarce. But if genetics are playing the biggest role in your mood disorder, you may not get the same level of relief as others do from these therapies. It's important to work with your healthcare providers to figure out what is working for you, what isn't working, and what can be done to help your situation. Here's a chance to check your privilege. Imagine what having a mood disorder is like for just a second. These are people who are experiencing prolonged sadness and helplessness for weeks, months, and years at a time, or feeling extreme sadness and helplessness followed by periods of extreme energy and impulsivity where rest feels next to impossible. If you can't imagine any of that, consider yourself fortunate. Consider having a bit more empathy and expressing more compassion for those of us with mood disorders. Unfortunately, a lot of times people will recognize when someone is down and will tell them something like, cheer up, or don't be sad. Saying these things may be appropriate for someone experiencing a normal depressive episode. However, when it has reached the threshold of a disorder, it is no longer a normal experience. And phrases like this are steeped in ignorance, no matter how well intended they may be. When you have a mood disorder, your emotional episodes aren't typical periods of dysregulation that you can snap out of or relieve with stimming and other soothing techniques. Depressive disorders sap all your energy, make you lose interest in activities you used to enjoy. They affect your sleep and eating habits, impair your concentration, or make you irritable and want to withdraw from people and places, and more. And mania also makes you restless, irritable, and impulsive. People with mood disorders are not vying for attention. We are seeking understanding and acceptance. Your opinions about how we should or shouldn't feel are irrelevant and not helpful. For those of you who may not have a mood disorder, I hope this helps you feel a bit more empathy and compassion toward those of us with mood disorders, and that you consider yourself lucky that you don't understand. Mood disorders run in my family. I have several relatives suffering from unipolar and bipolar disorders. I myself have been diagnosed with major depressive disorder at various points in my life, and I've been scraping my way out of autistic burnout for the last 5 years. And I bring up autistic burnout because that also differs from mood disorders, but only affects autistics. Autistic burnout is a complete exhaustion of a person's physical, mental, and emotional energy. Autistic burnout often comes with autistic regression, which is a loss of cognitive abilities. While autistic burnout is often accompanied with prolonged periods of sadness and hopelessness, and it mirrors a depressive disorder on many levels, autistic burnout does not always last years on end, so it's not the same thing as persistent depressive disorder. It may be closer to major depressive disorder if you are burned out for only a couple of weeks, or it could be its own illness if it lasts only a few days. Basically, autistic burnout is one more flavor of mental illness that we autistics can develop. Now, I'm not a doctor. However, I've dealt with depression my entire life. And in my experience, the best thing you can do for someone with a mood disorder, like persistent depressive disorder or bipolar disorder, is to first accept their situation. I'm not saying don't take steps to help. I'm saying stop telling us how we feel or should feel. Stop trying to convince us that our situation isn't as disabling as you think, or that there's more we could do to change how we feel. All that does is tell us that you don't understand and you don't accept our reality. Second, stop expressing disappointment in our lack of ability to get over it and move on. Stop thinking there's one day in the near or distant future when we will be back to normal. This can be difficult for employers who expect people to maintain a specific attitude, which usually includes always having a positive attitude. They may accept a brief moment here and there of irritability or sadness, but for bipolar disorders and severe unipolar disorders, our conditions are permanent. So no amount of lecturing us or telling us to get over it is helpful. And punishing us for it only worsens it. I understand the appeal of thinking positively, not wanting to accept that nothing can be done, so you may try to give us confidence and hope. But please understand, even positive pressures like these can exhaust us even further. In my case, one of the most effective and reassuring things you can do for me is to just be honest, realistic, avoid shaming me, and acknowledge the truth of my situation without dismissing how I feel and without minimizing it. So, for example, I remember several years ago, I was seeing a psychologist for depression and anxiety. After several visits, he ultimately told me I may never feel better. Now, to most people, that would seem like the opposite of what you'd want to hear. However, it was such a relief for me that I broke down sobbing. To me, it meant I could stop wasting my time and energy chasing rainbows. To me, it meant I could stop spending so much energy on seeking happiness or some other emotional ideology. It allowed me to accept my reality and to give up on the impossible dreams of being normal. Some of you may hear this and believe I was just giving up on my dreams, but that's not really what happened. It's more accurate to say that I conceded to reality. Because imagine if you're me, you're trying to be happy so much so that you're faking it to make it. You take everyone's advice and get no relief. You try talk therapy, meditation, positive thinking, religion, study and relaxation, and get no relief. You try losing yourself in charity and work, and you get no relief. You drag yourself out of your safe space and subject yourself to sensory torture and get no relief. This has been my reality for decades. Having a false hope that there must be something I could do to become normal became a recurring act of futility that made me more depressed when I would fail to attain happiness over and over again. So if you have someone in your life who is suffering from a mood disorder, my biggest tip is to stop making their disorder about you. They are under no obligation to feel how you want them to. If you find yourself saying things like, I just wish, or I want so-and-so to be better, listen to yourself. Your wishes literally start with I. They're literally about you and what you want. It doesn't matter how well-meaning you are. It's not about you or what you want. It's fine to have hope for someone, but insisting a person has your idea of an ideal life is a demonstration that you do not accept them or their situation. You are leveraging the love that you share and setting a condition on it that they need to live up to your expectations despite not having the energy to do so. It tells the other person that you are incapable of being happy for them or with them until they present themselves the way you want. If you find yourself saying these things, I get it. You don't have any ill intentions. You are grieving the loss of the possibilities you imagined for that person you care about. But those possibilities are imagined. They are fantasy. It would do everyone a whole lot more good if you could simply let go of the fantasy and accept their reality. Don't try to make the other person behave or feel the way you want them to. Acknowledge that they are doing their best just like everyone else. Embrace their differences and accept that your desires for their happiness are not based in reality. My hope is that this video has provided some understanding and perspective about those of us living with mood disorders. These conditions are serious. They aren't anything to be dismissed. Unipolar and bipolar disorders are as real and beyond control as choosing your skin color. So please accept us as we are. Don't expect us to be like you or shame us for not being privileged enough to be as happy as you. You don't need to fear us because we are different. Our moods are not an affront to you. We all have a right to express ourselves authentically. We don't need an attitude change. We aren't overly negative, and we don't need to think happy thoughts because this isn't a mind over matter situation. When we have a disorder, we can't pretend our way out of our condition. So don't gaslight us by telling us we just aren't trying hard enough. Treat us with kindness and compassion because we are all simply doing our best to survive. And until next time, thank you for watching. If you enjoyed this video, please comment, like, and subscribe to see more content like this. Or click on the video here to continue watching.